In this video, I'm going to talk about muscles of the shoulder, specifically the ones that act on the humerus. All right. So we'll start with the deltoid. So the deltoid is a fairly large muscle, a fairly superficial muscle that comes over the glenohumeral joint. Typically, we can talk about the deltoid acting as one muscle. Okay. We can also divide it into 3 different muscles. All right. So the origin is the lateral third of the clavicle, the acromion, and the spine of the scapula. Hint, it's the same as the insertion as the trapezius, so that should help you remember those two. So it comes from here and then comes down to the deltoid tuberosity. It's kind of like a triangle, and delta is actually triangle in Greek. So the muscle as a whole is going to have a line of pull kind of like this. So really right over the top, okay, even though it kind of comes like this, like a triangle, like I said. So coming right over the top, its primary motion is to abduct. And when we talk about the middle deltoid, it'll be the same way, okay? But we can also talk about an anterior deltoid, so one that kind of comes in front here. We can also talk about a posterior deltoid that kind of comes in back, okay? Anterior deltoid, okay, it comes on front, and because it comes on front, you would expect it to pull the humerus kind of superior and up, so it's going to flex. It can also medially rotate, so bringing the humerus towards the body in the horizontal plane. It can also do something called horizontally adduct, okay? So really that's just kind of moving towards the midline, which is what adduction refers to, right, in the horizontal plane. Okay, that's not a separate plane, it's just kind of a movement that combines two planes. Posterior deltoid is the opposite, okay? So same kind of position, same kind of line of pull, just on the other side. Okay, so now instead of flexion, you have extension. Instead of medial rotation, you have lateral rotation. And then instead of horizontal adduction, you have horizontal abduction. Okay, so moving away from the midline and the horizontal plane. And the nerve for the deltoid is axillary. Okay, so again, with the deltoid, you can talk about the muscle as a whole, abducting, okay, or you can talk about the anterior, the middle, and the posterior. So another big muscle on the front is a Pec Major. And the Pec Major, again, you can talk about the Pec Major acting as one muscle. Okay, it's basically the muscle that occupies your chest. You can also talk about it in 2 parts. Okay, if you talk about it in 2 parts, you'll talk about an upper portion, also known as the clavicular portion because it comes from the clavicle, and then the lower portion. So the origins of the Pec Major are medial half of the clavicle here, and then the sternum and ribs 1 through 6, and they're all going to insert onto the crest of the lesser tubercle. So it's kind of going to be like here and like here. Okay, again, it's a big muscle of your chest and kind of all comes together at the crest of the greater tubercle. When we talk about the upper pec or the clavicular part, okay, that's going to be looking kind of like this. All right. It's going to look, basically have a very similar line of pull to the anterior deltoid, okay? So it's going to flex, and it's going to medially rotate, okay? And again, that's just the upper part, okay? A lot of students, when you say Pec Major, say, oh, it's a flexor. Only the upper part, the clavicular portion, is a flexor, okay? When we talk about the lower part, okay, that's going to be more like this kind of line of pull. And it's actually considered an extensor, even though from the anatomical position it can't really do a lot of extension. It's kind of more from a flex position. Okay, but it's considered an extensor, just the lower part. The muscle as a whole, I think you sort of have to think about that whole muscle like this, is primarily going to adduct, ADD. So if you think about it, if you think about the muscle kind of coming in basically kind of like this, right? From this position, it's going to pull the humerus in. So it's an adductor. It's also going to medially rotate, okay, so pulling the humerus towards the midline in the horizontal plane, okay. Nerve is the medial pectoral for the upper part, the clavicular part, and medial and lateral pectoral for the for the lower part, for the entire muscle. So again, it's only, we talk about the muscle as a whole. So this whole muscle, okay, is being an adductor, adductor, and medial rotator. It's only this upper part that is a flexor. Okay, just the upper part is a flexor, and the lower part is actually considered an extensor. And again, the nerve is medial and lateral pectoral. Okay, and that's the Pec Major. So moving over to the back here, okay, so we have latissimus dorsi and the teres major. Latissimus dorsi is a really big muscle. It's kind of like your flank muscle. And if you think about the trapezius as most of your superficial back, you know, up here, latissimus kind of fills out everything else. It has multiple origins. It's the spinous processes, remember the guys that stick right out, 1 through 6 thoracic vertebrae, lower 3 and 4 ribs, posterior iliac crust, which is this, and then something called the thoracolumbar fascia, okay, which is basically, or thoracolumbar aponeurosis is another term. It's really a very thick spot of tendon and fascia that comes in the low back. We'll talk about it more when we talk about the back. But for now, it's another insertion spot. So you have, those are your, or another origin spot, I should say. And then it inserts, okay, so you think about kind of, it's coming from over here, you have to pick a spot, and then it kind of snakes underneath and comes to the intertubercular groove of the lesser humerus, okay, of the lesser tubercle of the humerus. And then teres major, also known as latissimus dorsi's little helper, comes from down here on the lateral border towards the inferior angle of the scapula, and it's also going to kind of snake in, and it actually comes to the lesser tubercle. Okay, so even though these are very different muscles in terms of the way they look, latissimus is a really big muscle, multiple origins, and the teres major is quite a bit smaller. They actually have pretty much the same line of pull and the same actions, which is why anything latissimus does, teres major does too. So thinking about just picking a spot here for latissimus and coming underneath here like this, okay, you should see that it's at an angle, okay, so it's going to be able to pull the humerus towards the spine, towards the midline, so it's an adductor, okay. It's also going to be able to extend, right, because it's going to be able to pull it back, and it's also going to internally rotate or medially rotate. This is one that a lot of students sometimes get confused, because most muscles that come from this posterior side, they're usually going to laterally rotate, right? That's, you know, we talked about with the posterior deltoid and all that. But both the teres major and latissimus do something a little bit sneaky. They actually snake in underneath, okay? They don't come over the joint. They kind of snake in underneath. And so what happens when they pull, they're going to pull immediately, okay? Even though they come from, it's more logical to think of them pulling laterally. They're not. They come from inside, and they're going to both pull medially, okay? So both latissimus dorsi and teres major, they're going to adduct, they're going to extend, and they're going to medially rotate, okay? The nerve for latissimus dorsi is thoracolumbar, and the nerve for teres major is the lower subscapular. So going on to the rotator cuff. The rotator cuff is 4 muscles that literally kind of do a cuff around the humerus. They're very important for stability of the humeral head in the glenoid fossa. And there's 4 of them. There's SITS is an acronym. A lot of students think about to remember them. Supraspinatus, infraspinatus, teres minor, and subscapularis. So the infraspinatus comes from, or supraspinatus, excuse me, comes from the supraspinatus fossa, which is up here, and it's going to insert onto the greater tubercle. The infraspinatus comes from the infraspinatus fossa. It also inserts onto the greater tubercle. The teres minor is going to come from this lateral border here, and is going to insert onto the greater tubercle. And the subscapularis is actually going to come from the subscapularis fossa, which is in front, and come straight across to the lesser tubercle. So the infraspinatus, again, comes from up in here, okay, and it basically comes straight over the joints, okay? It basically has the same line of pull as the middle deltoid, okay? So its only motion is abduction, okay? So it comes straight over the joint, it's only going to abduct, and its nerve is suprascapular, excuse me, suprascapular. The infraspinatus, okay, that comes from this infraspinatus fossa to the greater tubercle, but it's quite a different line of pull, okay? It's basically coming from the posterior, okay? So even though the supraspinatus fossa is posterior, the way that the that muscle, the way the supraspinatus muscle goes, actually, is really straight over. Okay, it's really straight over the joint. It's really the infraspinatus is going to come from the posterior part. So it's going to be able to pull the humerus back in extension. It's going to be able to, because it's kind of in an angle here, pull the humerus towards the midline, which is adduction. It's also going to be able to pull the humerus laterally in the horizontal plane. So it's going to be a lateral rotator. And when the humerus is up at about 90 degrees, it can also horizontally AD deduct. Okay, so that's 4 actions: extension, lateral rotation, adduction, and horizontal AV deduction. But it's only when the humerus is up like that. And it's also suprascapular is the nerve. The Teres Minor that comes down here has all the same actions as the infraspinatus. Okay, so even though it's a bit different spot, it's basically the same line of pull. Okay, so from that lateral towards lateral, it's right above, I believe, the Teres Major on the lateral border near the inferior angle. And it's going to do the same thing: extend, adduct, laterally rotate, and from this position, it's going to horizontally AD deduct. Okay. And its nerve is upper and lower or subscapular. Subscapularis is in the front here. It's anterior. Okay, and again, it's a little hard to do to kind of string it up basically, but it basically comes straight across. Okay, so from the anterior part comes straight across to actually the lesser tubercle. So its only action, it doesn't come over the joint. Okay, so it can't abduct. Doesn't come under the joint. Can't adduct. Doesn't really come anterior to be able to flex. So because it's only straight across, its only ability is to pull the humerus towards the midline in the horizontal plane. So it's a medial rotator, and that's it. And its nerve is upper and lower subscapular. Okay. So the rotator cuff, one way to remember the rotator cuff is you have the infraspinatus that comes straight over the top. Okay, that's your abductor. Your infraspinatus and your teres minor, they pretty much do the same thing. Okay, different nerve innervation, but the same thing. And the subscapularis comes from in front. Okay, and then just briefly, the biceps also flex the shoulder, but I'm going to talk about them when I talk about the elbow muscles. The triceps can extend the shoulder, but again, I'll talk about that with the elbow unit. The last muscle I'll mention is Coracobrachialis, that comes from the coracoid process of the scapula, and then comes down to about the mid-humeral shaft. Okay, it's on the anterior side, so it's going to be able to flex the humerus, and it's also going to be able to adduct because it's kind of got this angle going in. Okay, and its nerve is muscle cutaneous, and those are the nerves of the shoulder, or muscles of the shoulder.